Шановні колеги, ми продовжуємо робочий день в українському кризовому.
The topic of the next event is report on activities of the Ministry of Health of Ukraine, Dr. Suprun, acting minister, Oleksandr Linchevskyi, Pavlo, Kovtoniuk, Ilyk, and Oksana, Syvak, deputy ministers of health of Ukraine. Dear colleagues, welcome on stage. Good afternoon. Thank you for being with us today at this press conference. We would like to speak with you about the work that was carried out during the last 2 months. And you remember that I was appointed at the end of July. I became acting Minister of Health of Ukraine from the 1st of August 2016. And at the start of September, a team of specialists joined Ilyk. He was in the ministry, and other deputies, Oksana, Syvak, Pavlo, Kovtoniuk, and Oleksandr Linchevskyi. We work as a team for months. We returned from the ministry, and today we had donor meeting, donor conference, where 50 donors were gathered from the embassies of the different countries, and we presented our plans how to reform the system of healthcare in order that they helped us and help our clients, help our valuable clients who are patients of Ukraine. And what we said from the start, everything we do is for the benefit of our customers, and every patient is at the focus of attention of our ministry. I would like to tell you about the work that was carried out during the last 2 months. A lot has been said about state procurements through international organizations, and we completed the work for 2015, so all the supplies will be till November, and 60% of those medicines and the medical equipment that were ordered for 2015 are in the regions, and the rest equipment and medicines will be brought in 2 months. And also I'd like to say that vaccines that are ordered by UNICEF are not supplied because they should bring them till the next year to have the shelf life good, and till the end of the year we will have vaccines that are supplied by NDP and Crown agents. Also, we carried out a lot of work in 2 months that was taken by the same amount of activities during 15 previous months. So it's weird, but we reached results. We have 23 directions through the Cabinet of Ministers and others that were presented in the Cabinet of Ministers on Tuesday, and that are ready to be submitted to international organizations in order for them to choose in what areas they would like to work. So we write letters to international organizations, and this week we have talks with the 4 international organizations that will cooperate with us in procurement for 2016. And these organizations, a lot of speculations are going on with whom we are going to work. We will cooperate with the representative of UNO, UNICEF, UNDP program, representatives of Crown Agency, and new international organization partners in the sphere of supply and the supply management, supply chain management, that this year will cooperate with us. And we can speak about it in more detail if you have questions. So we work daily in order that that this year was ended this year's to procurement for this year, and that supply began and 2017 in January we will make procurements for 2017. So as you may know, the budget was supplied to the Supreme Council, and from the ministry we got additional financing for our patients. 6% increase. They increased the funds for treatment of patients. Also, we got 2 billion hryvnias for procurement of medicines that we buy through state procurement. And also we got increase in financing for treatment abroad. And also treatment abroad is continuous, and when we came to the Ministry of the Funds, we were exhausted. All the patients who had the opportunity to, were included in the budget plan. This program was completed, but together with the deputies of the Supreme Council and together with public activists, we worked on the budget with the budget committee, and we found additional financing in order to send 30 patients that are not treatable in Ukraine, that these citizens of Ukraine can be treated abroad. 13 of them are children, and we are very glad that we can cooperate with the deputies from and other ministries and NGOs in order to make positive changes to improve the lives of patients here in Ukraine. And during the last months, we also continuously work with the Cabinet of Ministers and other groups in order to show what changes we want to see in the Ministry of Health and the system of treatment of patients and healthcare on the whole. And last week we had the meeting headed by the Prime Minister, and there were deputies present of the Supreme Council from the Committee on Healthcare. There were oblast councils of 8 different oblasts, and also representatives of there were mayors of the cities and the experts and the representatives of other ministries that got involved in the system of healthcare. Also, we had the opportunity to present our plans there, what changes we envisage and how we can implement the changes in the sphere of healthcare in order to improve for each of us the access to quality medical care. And lastly, at the end of our meeting, the Prime Minister, he assured us that politically he undertake responsibility to follow those changes to help us in order that together with the Ministry of Health and together with the Cabinet of Ministers and the Prime Minister and together with the deputies of the Supreme Council and the Oblast Councils and the cities and the regions and the communities and the community activists and organizations and with the representatives of medical community and doctors and of course the most important, together with patients, to change the system for the better. And lastly, I would like to tell about more global things. Decentralization now is going on in our country, and a lot of efforts have been put to decentralize the power and in provision of services. The Ministry of Health should deal in policy, in public health, and also it should deal with regulation. We shouldn't treat each patient. Treatment of patient is should be dealt with by nurses, doctors, not the ministry. We want to provide the opportunity to our doctors to treat people, that our medical workers could do this, and locally there should be the best way, and each patient should get access to a doctor, and our hospitals and our polyclinics and other medical institutions should have choice. They could organize the way they wanted, not as Kiev tells them. So a big step ahead in this way to implement decentralization is the cancellation of Order 33, when the ministry ordered the hospitals what is the number of the staff. And in local hospitals and in big oblast hospitals, that is in Kiev, and in some small hospital, that is in Odessa, and in the regional hospital in Cherkasy. I believe that all of us, we agree with the fact that our doctors, our chief doctors at places and our local councils better understand the needs of the regions. We want to provide them with opportunity to solve those issues. It shouldn't go from the top, from Kiev, from the ministry. I also would like to thank my deputies for their work during the last months. We worked a lot. We are a good team. We entered with a single idea and we proceed to our goal. Each morning we gather in my study at 8:30 in the morning, and so 45 minutes we are speaking and we plan our day and we speak about our problems. And at the end of each meeting, we ask ourselves what we are planning to do in order to improve the system of public care, public health for our medical workers and for patients, for all Ukrainians. And each day, at the end of the day, I ask myself what I did in order to improve the system. Often it's difficult for me to see what is done. A lot of documents, a lot of meetings, a lot of conferences, but I believe that each of these events are real steps, and step by step we are going into the future where we will see the improvement of the system. And I believe that my deputies will work together with me with all their efforts in order to achieve this. And I want to have questions now, so you can ask questions, and my deputies also can answer questions. Each of them have their area they specialize in, and they carry out reforms and work in the fields they are responsible for. Pharmaceutical area, licensing, Oksana, Syvak, Euro integration, and public health issues, Pavlo, Kovtoniuk, financing of the system and the changes and reforms, and Oleksandr Linchevskyi, he deals with medical education and healthcare. So thank you very much for your attention. So now questions. Please introduce yourself first. Yaroslava, Ukraine News. Ulana, question to you. First question about the postponement of the supply of oncology medicines for children. We know the position of Ukrainian distribution crown agency and the ministry, but all these stakeholders, they communicated, but oncology patients, children, went without medicines. Maybe you should say officially that you are sorry because of this, and what should be done in future to prevent this. You know that all the doctors of Ukraine, they they are sworn in with the special pledge of Hippocrates. So as to the situation about oncology medicines, it was difficult. Crown Agents is the international organization that dealt with this area. They opened their tenders for everyone, including Ukrainian distributors. and the majority of Ukrainian distributors, they and Crown agents and our ministry, we got this medicines fast, and there was a problem connected with the oncology medicines. This is not only about kids. There are other problems also with the medicines for adults in this area. I do not know whether it was done intentionally or not, but distributors that dealt with that issues, this distributor didn't want to meet the requirements. So the procedure, this was before I came to the ministry, it happened. They were proposed to do this. They waited 90 days, or when they raised some issues, and the process was started all over again. You know that the process continues. We have some problems in the area. They provided us with medicines, but the shelf life of these medicines is much less than state requires, and we cannot import these medicines if they have a shelf life that is less. And we discussed it with Crown Agency, and they reacted quickly, and in 2 days they provided a letter, guarantee letter. If we don't use this medicine, they will make they will replace these medicines, and all these negotiations are in the special group, working group. There are representatives of the ministry and public organizations, civil society organizations, and NGOs together with us decide the problems that are at the customs, and those problems connected with what medicines should be bought, and also with what organizations to cooperate with. And I believe that they also can answer some questions, problematic issues, because they were involved in these processes from the very start. And what can we do in order to prevent these problems in the future for 2016? So we include in our contracts, agreements, that international organizations should supply a schedule when these supplies will be made. And also they decided that they will cooperate differently with Ukrainian distributors in order to prevent these things. This is the internal decision. And unfortunately, because of such things, they will cooperate less with Ukraine, and they will buy it from the producers or from international distributors, because Ukrainians created unpleasant reputation because they didn't want to cooperate with international organizations. I don't know whether you know about international organizations. We all know who UNICEF are and who are NDP. These are international organizations that are agency of UN. And Crown Agency is the big and powerful international organization that deals with such procurement in the United States as well for years. And I have meetings with all our organizations that supply medicines to us. We communicate with them about our contracts, and the Crown agents, they are concerned because there are some people say that they are corrupt or they have some unfair ways of business. And I can say that we cooperated with them, and they always meet our requirements. They cooperated with us. They tried to solve the problems. And I can say that this was the blame of Ukrainian side. And this is one distributor, one party that delayed the process. And I believe that other organizations that will work in Ukraine will see this and react. Oleksandr. So the question about the oath, and it is heard in the ministry. We should pay more attention to medical education, medical training, and the level of awareness among the medical staff. But the matter with this oath of Hippocrates, the people who speak about it, they never saw it, even in Wikipedia. In 21st century, it would be strange to make oath, and no one now do it in any country of the world. This document that is attributed to Hippocrates, it is only fiction. Don't speak about it, about this oath, because maybe doctor has some protection because of this text. Yes, there are principles, basic principles, and also respect to teacher, the way how to provide knowledge to other people, ban on abortion, or that doctors should not help people to make suicide. This is an interesting historic document, but no one makes this oath nowadays in the world. You can just read it in the history books. So you shouldn't put historic and philosophic questions. This is a briefing. I have a question to Ulana. The first one, as we know, you are a laboratory worker and you had some courses in California college and you don't have higher education. Do you have higher education, or are you planning to get this higher education, and what university? And second, can you tell us what vaccines should be injected, provided to a child during the first year of life? Do you have a smartphone? Do you have it? Do you know what Google is? Have you ever placed my name there? You can see where I studied, where I worked, and where I worked in New York for 20 years in New York. I worked in Michigan in the hospital, and I also graduated from the medical university. I have never been to California, and I have never studied there. I'm not from California, I'm from Michigan. I don't understand where do you get this information, but I advise to you that you should have some journalist work, and you shouldn't ask such questions to me. This is not appropriate. The answer will be similar. There is a legend how Einstein passed the exams. He was asked what is the distance from New York to about the distance between the cities. And you know that schedule of vaccination in the world doesn't differ from Ukrainian schedule. So polio and other infectious diseases are included in the schedule. And I don't believe that a minister should hold in his head or her head the information that can be found on the internet through one click. So I have a question to Ilyk, and maybe Olena will tell us. So on the internet, they say that there are some charitable funds that deal with the oncology patients, and they say that some producers whose medicines were bought through international organizations. So these medicines were not supplied to Ukraine, but these companies, because international organization bought from them, these companies stopped supply of these medicines in retail, and there is no such medicines in the drugstores, and they were not supplied through governmental channels, through the state channels. Do you know about such facts? And maybe the international producers shouldn't limit the supply to a retail chain. So procurement through state programs should not influence on supply of medicines that go through humanitarian funds, because what is bought through international organizations, these are state procurements that were carried out until recently through state programs that were Ukrainian producers or distributors. And maybe you read about it, but this is not correct approach to international organizations, whether they took responsibility for state procurement, because those medicines, they do not differ from what was before. So I do not know about these matters. So maybe some people addressed, some charitable funds address whether they should supply. They didn't address to us these funds. And patient organizations and or hospitals, they didn't say that they get something, didn't get something. So maybe you should provide us with such information if there are problems, and we can then communicate with them on these issues, and to show the percentage what we can buy through state funds, and then international organizations can see that there is a need and they could supply the medicines. And if you can provide information after press conference, I would be grateful to you. Roman, do you have such information? Did someone address? No, we don't have such information. Thank you for telling us about it. And we had a donor meeting today. This wasn't, there were, so we didn't raise this issue during the meeting. But we will speak with them and we will show our real needs to them in order them to know it through our ministry. Thank you very much. Next question. Anastasia Simonova, Stebe. And is there any investigation on Melnikov's death? And what about financing of housing for those Ukrainians who were sent by the Ministry of Health abroad? And also, what is the situation now with this bringing patients abroad?
Let's start with the end. As to the transplantation and sending abroad is a very painful issue, because we are waiting and the community is waiting for adoption of the law on transplantation that will make it much easier to work. Ukraine has technical possibilities for transplantation. We have surgeons, we have necessary equipment. Currently, Ukrainian surgeons can manage transplantations with no assistance from abroad. These transplantations are widely spread at a high level, not only in Kiev. And currently, we have multiple cases of successful transplantations, not only family but corpse transplantations. We have experience, we have opportunities, but the only thing we need is a law. So without this law, waiting for its adoption, a working group is carrying out working meetings. And if you look at funds sent abroad, to send patients abroad, and these funds that could be invested in the development of our transplantology, this is incomparable from the point of view of the state. We could save patients much more efficiently if we invest in the transplantation service. Hemodialysis patients, they have to receive transplantation of kidneys, and this is also another large item of expenses. Sending patients abroad is linked to funding of this program. If we have funds, then we can send patients abroad. If no funds, then they stay home. We incorporated changes to the resolution. I think that we will be able to publicize the procedure very soon. The current procedure of entering a patient into the waiting list is quite complicated. It involves corruption risks, and this procedure is quite lengthy. A patient finds clinics, then he or she arranges and negotiates all the things. Then after a decision on transfer fundings is adopted, the patient cannot go abroad on the same day. If we incorporate changes to the resolution, that will be very good for us, because a patient who needs treatment abroad could get into the waiting list much sooner. Then we also can talk about the Commission who can gather regularly, that the patient who needs treatment shouldn't be dependent on the meeting with the chief specialist, but he or she can send immediately from his location. Then it excludes, it gives the patient opportunity to get into this waiting list. And also the Ministry of Health Care plans to settle letters of guarantees with clinics, to have negotiations in advance, to be able to send a patient without funds coming to an account. So there are tools, the means that can help patient to get to the treatment place. As to the investigation of the living conditions, I'm not ready to comment on them, because it happened that the death of patient Melnik happened before we came into the team, and I didn't follow this question, but I promise that we can get necessary data and communicate them later. Unfortunately, our time in cooperation has been exhausted, so I wish you good luck. Thank you very much, and see you later.